This is an in-service training program presented by Nutrition Care Systems. Today's topic, congestive heart failure and dietary sodium. Today's learning objectives: number 1, understand the definition of sodium. Number 2, be familiar with the definition of congestive heart failure or CHF. Number 3, discuss the various signs and symptoms of CHF. And number 4, understand the recommended dietary guidelines for sodium. So what is sodium? Well, it's really an essential element for all plants and animals. Sodium also helps with the function of nerves and muscles. And in our diet, it's measured in milligrams, or abbreviated mg. So 1 teaspoon of salt equals 2,300 milligrams of sodium, and that's generally the total recommended for an entire day. But many people consume way more than that. But that's the recommended amount, just 1 teaspoon of salt a day, or 2,300 milligrams of sodium. Here's some helpful information. A lot of people in the United States get way more sodium in their diets than they need. The typical resident menus contain about 3 to 4 grams of sodium per day, or even more. The sodium can be reduced by using more frozen or fresh vegetables. For example, you can see the asparagus on here. Making soups from scratch, using fewer processed foods, because the processing is what contains a lot of the sodium. And season foods with herbs rather than salt. Also, those people with medical problems such as congestive heart failure, kidney disease, or severe high blood pressure, they may need even less than the 2,300 milligrams of sodium that's recommended for the average person. They may need 1,500 milligrams of sodium or even less per day. So here's a picture of herbs and spices, and these are the kind of things that can be used to flavor the foods instead of salt. So what is congestive heart failure, or CHF? Heart failure means your heart cannot pump enough blood to meet your body needs. And over time, the conditions such as narrowed arteries in your heart, or coronary artery disease, or high blood pressure gradually leave your heart just too weak or stiff to fill and pump efficiently. And that's where they call it CHF. What are the signs and symptoms of congestive heart failure? Shortness of breath on exertion or when lying down, fatigue and weakness, swelling or edema in the legs, ankles, and feet, rapid or irregular heartbeat, reduced ability to exercise. Other symptoms: persistent cough or wheezing, swelling of abdomen, or it's called ascites, sudden weight gain from fluid, perhaps 3 pounds in 1 day or 5 pounds in 5 days, lack of appetite or nausea, difficulty concentrating, or decreased alertness. We talked a little bit about it earlier, but the recommended sodium guidelines. The salt and sodium intake goal is to reduce it to less than 2,300 milligrams per day. Doctors do prefer residents with congestive heart failure to be on a 1,500 milligram per day diet of sodium. 1 teaspoon of salt, as you remember, is 2,300 milligrams of sodium. So if someone's going to be on a 1,500 milligram sodium diet, it's very restrictive, but obviously very important as far as controlling the symptoms of CHF. Many people that are watching their sodium can get a lot of great information from the nutrition facts that are on many food labels. For example, sodium-free means less than 0.5 milligrams per serving. Very low sodium means less than 35 milligrams per serving. Low sodium means equal to or greater than 140 milligrams per serving. Reduced sodium means at least 25% reduction per serving. No salt added or unsalted may not always mean sodium-free, because some foods contain sodium naturally, so just to kind of be aware of that. In order to be salt-free, foods have to meet criteria for sodium-free. Light or light in sodium means a 50% reduction in sodium. Lightly salted means 50% less sodium than normally is added. But also remember too, some foods that contain a lot of salt don't taste salty because the salt may be masked by other ingredients. An example of this is that sugar in breakfast cereal can mask the salt actually that's in the cereal. Often fluid restrictions are advised when someone has congestive heart failure. Fluids are anything that become fluid at room temperature, such as beverages, ice cream, sherbet, ice, gelatin, pudding, liquid supplements, and also watermelon has a very high fluid content, so you want to make sure if someone's on a fluid restriction that they avoid having watermelon. Let's see what you learned in this in-service on congestive heart failure and dietary sodium. 1 teaspoon of salt contains how much sodium? A, 500 milligrams, B, 1,000 milligrams, C, 2,300 milligrams, or D, 3,000 milligrams of sodium. And the answer to question number 1, 1 teaspoon of salt contains how much sodium? And the answer is C, 2,300 milligrams of sodium. As I remember, we talked about that earlier in this in-service. Question number 2, which of the following is not a symptom of CHF? A, swelling of feet, ankles, and legs. B, persistent cough. C, lack of appetite. Or D, rash on the body. And the answer to question number 2, which of the following is not a symptom of CHF? As you remember, swelling is a symptom, as is persistent cough and lack of appetite, but rash on the body is not a symptom of CHF. Question number 3, which of the following does not need to be counted when a resident is on a fluid restriction? A, ice cream, B, banana, C, watermelon, or D, beverages. And the answer to question number 3, which of the following does not need to be counted when a resident is on a fluid restriction? And that would be B, banana. Ice cream would need to be counted, watermelon, and beverages need to be counted on a fluid restriction. Question number 4 is a true or false question. Some foods that contain a lot of salt may not taste salty because the salt may be masked by sugar. And the answer is true. We talked about cereal having enough sugar in there that it actually masks the taste of the salt. Even though cereal does contain salt, you may not taste it. Question number 5, true or false? Sudden weight gain is usually not a cause for concern. And the answer is false. When someone has a significant sudden weight gain, that is a definite cause for concern. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or our consulting dietitian services, please contact us at Nutrition Care Systems, 1275 Davis Road, Suite 121, Elgin, Illinois, or visit us on the web at nutritioncaresystems.com.